Hello everyone, I'm Dr. Anupriya Goel from Berkowits Hair and Skin Clinic, and today I'll be talking about the various methods of hair transplant, some pre-procedure instructions and some post-procedure precautions. So keep watching. There are four major methods of hair transplant. The first one being FUE or follicular unit extraction. This is a traditional method in which a follicular unit is extracted from the donor area and implanted in the affected area or the bald area. The second is the FUT or the strip method, in which a skin strip is excised from the donor area or the back of the scalp. The follicular units are taken out from the strip of skin and implanted in the bald area or the affected area. However, this method is not very commonly used now, as this can leave a scar behind. The third is the robotic transplant. It is a breakthrough technique which increases efficiency and promises better results because it leads to controlled suctions of hair root, and because of this the hair root is undamaged. Fourth and the most recent one is Max Grow FUE. In this procedure, the extraction and the implantation of the hair root is done at the same time. Hence, the hair follicle does not need to be placed outside the body for a very long period of time. Hence, this boosts the growth and survival of the transplanted hair, making it much more effective. Now, there are a few pre-procedure instructions that you must follow before you go for a hair transplant. First, stop taking any blood-thinning medication like aspirin or even ibuprofen before you go for a hair transplant. Stop taking vitamin E or ginkgo biloba before you go for a hair transplant, as this can lead to increased bleeding during the implantation and make it more difficult and time-consuming. Secondly, stop taking minoxidil or minoxidil-containing solutions before you go for a hair transplant. Third, start taking vitamin C 1000 mg twice a day before the surgery. Avoid intake of alcohol at least a week before your surgery, as this can lead to increased bleeding. Avoid smoking at least a week before, as this can lead to constriction of blood vessels, which prevents the supply of oxygen-rich blood to the site. Avoid heavy cardio exercises, heavy weightlifting, and bodybuilding supplements before the transplant. After the hair transplant, you can easily resume your work within 48 hours of the surgery. However, you're advised to wear a cap and avoid exposure from the sun and dust. After 48 hours, there is band-aid removal, and after 7 days, there is another session of crust removal of the transplant. Avoid drinking alcohol and smoking after 7 days of the procedure. Avoid heavy exercises and heavy weightlifting, steam sauna and swimming at least a month after procedure. No use of helmets and tying of turban for at least 2 months, and no use of hair dryer for at least 6 months after the surgery. So hair transplant is a very safe and effective procedure, and it is a long-term investment of your money. I hope you found this video useful, and if you have any more doubts, kindly post a comment below. Subscribe to our channel, and you can even follow us on Instagram at Dr. Anupriya Goel and at Berkowits Clinic. Stay healthy, stay beautiful. Thank you.